The impact of next week's presidential election in the United States will also be felt in Africa. In Kenya and other sub-Saharan countries, Donald Trump's decision in 2017 to reinstate a ban on funding for abortion has impacted the lives of millions of women and girls. The move has left some healthcare services hanging on by a thread and desperate for change as they see women dying from unsafe abortions. DW's Marielle Müller reports from Nairobi.
For Frida Kanzi, getting pregnant was a disaster. She was studying at a secretarial college. The bright future she was working for suddenly seemed threatened.
When I knew I was pregnant, I had no options, and what it was on my mind was just thinking of killing myself, and no one could know this. Was just thinking that I'm nothing. What I can say this.
Her lucky break? She was referred to Venoma Clinic. She underwent an abortion and now feels she has control, thanks to contraceptive implants.
First, the pregnancy, it could distract my education. It could lead my parents to take me out of the house. I could have lost a lot of things in my future.
But the clinic is under threat. Decisions made a world away from here slashed its funding. US President Donald Trump reinstated the Mexico City policy, restricting funding for organizations which provide abortions or anything related to them. It made life in many towns, like here in Malindi on the Kenyan coast, more dangerous for women and girls.
We used to provide free family planning, free information. We are unable to provide family planning freely today because we don't get them anymore for free. This affects the young girl. In most cases, they report when they're pregnant, when they're not ready for the pregnancies. So this forces some of them to deliver or forces them to have unsafe abortion.
Kefin Ojunga runs the Venoma clinic that helped Frida. The cuts forced her to cancel an outreach program helping 15,000 other girls and women in rural areas. That help had included cancer screenings and HIV treatment. She dips into her own personal finances so that what is left can keep running. A priority is to protect girls and women from unsafe abortions.
If I don't do it, then I'm afraid the next neighbor, the next person will do it the wrong way, that causing death to our girl and young women.
The threat of financial punishment for having anything to do with abortions is affecting Kenya's national health policies, says Country Reproductive Health Coordinator Kenneth Mirithi.
Bearing in mind that our constitution gives very big precedence to sexual reproductive health, we have resorted to not following our constitution because of fear.
The choice of the US president will not only decide whether Kenya can follow its constitution. Kefin says the man who ends up sitting in the White House could mean life or death for her patients.
I would wish that somebody else sits on that seat, somebody else who would understand there's a human being in need of that fund, that there's a human being dying simply because there's no information given to her. Once this person gets on that chair, then we are sure our girls are going to have the information and they are going to be great lawyers, great doctors, great mothers in the future because they will have information to plan their life.
Let's find out more from our correspondent, Marielle Müller, who sent us that report. Hello, Marielle. Can you tell us more about the effect of this US policy on Kenya?
Yes, so when Donald Trump became president in 2017, he not only reinstated the Mexico City policy, but he extended it significantly. So there was not only family planning funding affected, which was already $570 million, it was up to $9 billion that were affected now of global health assistance money that was missing in countries all over the world. So that means child and maternal health, treatment and prevention of HIV, tuberculosis, malaria, and several other infectious diseases, and also nutrition and sanitation programs were affected. So it had a huge impact on people on the ground. And that also means that healthcare workers like Kefin and her team, they were not able to reach villages which were up to 100 kilometers away sometimes. And the villages, they say, well, if we don't get the services, then we look for solutions on our own. And these solutions are mostly unsafe solutions. So a recent study actually showed that during the time that the Mexico City policy was in effect in the past, that there was an increase of abortions of up to 40%. And these abortions are most of the time unsafe abortions. And that means there's an increase of death cases.
Rather unfortunate there. I mean, there's a saying that you cannot put all your eggs in one basket. Are there any alternative funding or opportunities that the country can explore?
So concerning, for example, Kefin's clinic, she's part of a wider network of reproductive health facilities, and they lost up to $1 million per year funding. So there were foreign countries, European countries, that stepped in, that tried to fill the gap, but it was only less than half, actually a quarter of the funding that was there for then, and it also for a very specific and limited time period. So that means that they had to find other solutions. And Kefin, for example, and I know from other facilities as well, that they chipped in with their own private money, that they had, doctors and health workers lost their jobs. So they also still buy reproductive, contraceptives and medicine, and they still try to give it out cheaper. But most of the times it's also not possible. Some clinics also had to close. So that's actually like a problem for these facilities.
Now, what is the government's plan to ensure women's rights to abortion is protected if Trump remains president after the U.S. elections?
So yes, so I talked to the reproductive and health coordinator of the county there where we were filming, and he told me, well, there's actually no plan for that. I mean, like no plan change, actually. So they expect the situation to get worse, or at least to stay the same, or even get worse. So he also told me of, cases on the ground where, women have actually the right, the constitutional right to get a safe abortion. So if they come to a government-run facility, to a hospital, for example, and they procured an unsafe abortion and they're in dire need of help, they die in the waiting room sometimes, he told me. And these cases are not rare cases because doctors and healthcare workers are too scared, too afraid to treat them because they are afraid that their funding might be cut as well.